In this morning's medical alert, major progress identifying and treating lung cancer is leading to a decrease in mortality rates. The American Cancer Society published its annual report last week showing some significant progress in the fight against certain cancers. Overall, cancer deaths dropped by about a third from its peak in 1991 to 2019, with lung cancer contributing most to the decline. And joining us live this morning to talk more about the finding is the Chair of Radiology and Oncology at GBMC, Dr. Robert Brooklyn. Thanks for joining us.
Well, good morning. It's nice to be with you this morning.
Well, great to have you. So what do you think is to account for the drop in mortality rates?
I think we've been having success in cessation of smoking. We're seeing increasingly more and more people quitting smoking, and we're also seeing lesser numbers of people starting to smoke. So all of these things are contributing to a lower smoking rate, which translates down the road to a decreased death rate.
And smoking is definitely not as popular as it once was, but not all lung cancers come from smoking. So there must be some other advancements that have been made in treatment as well.
Well, also we are seeing a significant increase in earlier diagnosis of the disease. It may in part be because of screening and also a greater awareness of the problem. And so we've seen a significant shift from higher stage cancers being identified to earlier stage. It's almost a 10% shift from higher stage disease into stage 1. And when we find the cancer earlier, we have greater opportunities to cure the disease.
Absolutely. And, the study also went on to support other findings that we've been hearing throughout the years about racial and geographic disparities that could impact preventable cancers. So what can be done about that?
Right. So of course, access to care is so important because, the Cancer Society has actually published articles demonstrating that it's better to have a higher stage cancer if you have insurance rather than a lower stage cancer with no insurance. And fortunately with the Affordable Care Act and the access to insurance, more people can get coverage. So that's one issue. The other issue is that some diseases may just be more virulent in those who are socioeconomically disadvantaged. And so that means we have to target screening for certain at-risk populations, and in so doing, we can improve the outcomes. Also, there's been concern about screening for prostate cancer in African Americans. We need to screen for prostate cancer.
And you mentioned how important early detection is, and of course during COVID, so many people have put off their regular checkups. What would be your plea to people to get them back in the doctor's office?
Yeah, so that's a great point. And we are very concerned about the decreased screening rates and medical care access during the pandemic. So it's still important to get appropriate health care, but to do it safely and increasing availability of home testing. So don't go to your doctor's office if you feel symptoms, but otherwise bring in a good quality mask and see your doctors and get your screening.
All right, Dr. Brooklyn, thanks so much for joining us this morning. Really appreciate it.
Thank you so much.
You're welcome, and stay with us.